Good morning, everyone. Welcome to the Arizona Pre-Admission Screening and Resident Review PASRR training. We're still going to wait a couple of minutes for individuals to join. I know that people have been looking forward to this training, so we'll just give it maybe 1 or 2 more minutes and then get started. I can start with some housekeeping for those who have joined. If you could make sure that your cameras are off and your microphones are muted, that will help quite a bit for bandwidth and any background noise. And this training is going to be for an hour, and we will have plenty of time for Q&A at the end. And if there are any questions that I don't get to, we will email out the answers and send those to all of the participants so everyone gets the same answer. And then afterwards, we have a survey. If you wouldn't mind telling us how we did, that would be fantastic. We'll give it 1 more minute. All right. I think we should probably just go ahead and get started. And as people join, anything that you miss, you can absolutely come back later and watch because these will be recorded. My name is Ellen Olson. Hello and welcome to anyone who just joined. This is the Arizona PASRR training. We're going to do a complete end-to-end PASRR training. I have been in the behavioral health field for over 20 years. I currently work at Essentia Health as the VP of Operations over about 9 programs right now, and 6 of those are PASRR programs in different states. I've worked in the PASRR field for about 17 years and very excited to do this training today for Arizona. We're going to concentrate on the federal requirements and your state's process and have, again, plenty of time for questions at the end. All right, let me go to the next screen. I do want to point out that we have, or Arizona, your state has a manual on your website. And what's great about that is it provides you all of the information you need about PASRR. This training will be added to the website and it'll be recorded. So anybody that missed it today can certainly watch it later. But you really want to make sure that you familiarize yourself with your own state's manual on PASRR. For our agenda today, we're going to go over everything PASRR, level 1, level 2, including significant change in condition, and all of the federal requirements so that you can make sure that your facilities are compliant with PASRR. Our goal, the state's goal, your goal, everyone's goal is that the entire state is compliant. So we're here to help you. If you have questions, please make sure to reach out to your state representatives, the people that typically help you with PASRR, because they want to make sure you get it right too. In the end, we're serving individuals who may need services, so we want to make sure that we're giving them every chance for services that they can get. If you have any questions, please feel free to put them in chat. We will go through those at the very end. So this is about an hour training with 30 minutes left at the end for Q&A. And there will be, I just happened to look at chat. There will be a copy of the slides sent to everybody so that you can have a copy. To everyone on that's registered will get a copy. All right, go back to that. So what is PASRR? What is the purpose? I get that question a lot. I think that sometimes facilities get the feeling that it's just a paper process. They just have to get it done and that there's no real meaning behind it. But really, there's a lot of rich history behind PASSR. It starts back in the 50s when you look at the movement that started for deinstitutionalization as those state hospitals began to close and as individuals were able to have more freedom of choice where they wanted to get their services. As they were coming out of those state hospitals, there wasn't a really great plan in place to have some of those services in the community. So what ended up happening is some of those people coming out of the state hospitals, they didn't really have any medical issues, but they ended up going into nursing homes. And that started to become a problem because nursing homes at that time were not equipped to handle all of those individuals with some of the serious issues that they had, the serious mental illness, intellectual disability, and other related conditions. So the federal regulations started being developed in the late 80s and were finalized in the early 90s. But the entire intent and goal was to make sure that no one ends up in a nursing home and that nursing homes become the next mini institutions. They want to make sure if someone is going into a nursing home that they need to be there for medical reasons. And that if they have some kind of protected condition, like serious mental illness or intellectual disability, related condition, there's a whole bunch of those, and we'll go over them, that they go in there, they're assessed, and if they have any other needs on top of their medical needs, that they can have services to support those as well. So again, the entire goal of PASSR is to identify anyone who might have one of those protected conditions. So it's really important that we sometimes even over-identify. So the level ones are really just looking for a suspicion. Do they possibly have, when I say SMI, I mean serious mental illness, ID for intellectual disability, or RC for related condition. Do they possibly have a suspicion of one of those conditions? And if they do, do they have a medical reason? Do they meet level of care for nursing facility services? Could those services be provided in a community setting? If not, and they need to go into the nursing home, what kind of other specialized services or additional services can be recommended so that they get that support they need while they're in the nursing home? So this is that rich history that I was talking about, but I do want to point out, really, I like to say there are 3 steps to PASSR. You know about the level 1 and the level 2 evaluation, but level 2 is really broken into 2 steps. There's the level 2 evaluation and then the level 2 determination. So you'll be completing the PASSR at that level 1, and you're going to want to look for any possibility of SMI, ID, or related condition. And then the level 2 evaluators are going to look at that individual and see if that person does have a serious mental illness or intellectual disability related condition. And then if so, part of that determination is to make robust recommendations for their care. Where should they go? What services should they receive and where should they receive them? So one thing that is really important that I always want to point out is this last bullet for nursing homes. So in 2016, the federal regulations have not been updated since the late 80s. They really are, just the same. They're in proposed status. They're looking at updating them, but they have not been updated yet. But your Medicaid participation rules were updated in 2016, and that's very important because what those Medicaid rules state is if a PASSR is completed and a level 2 is completed, a condition is confirmed, and recommendations are made, that information must go into the nursing care plan. And we'll go over how important that is and the whys of that. But just know that if PASSR happens, it must go in the individual's record at the nursing home. And if any recommendations are made, those must also go in the nursing care plan. And you will be able to make changes. However, you have to document why you've made those changes. All right, so PASSR oversight. Just quickly, I already pointed out, it is in rulemaking status. What's important about that is if there are changes, you may start to notice in your state a push. It might be that you're given a year, but a push for changes in how you look at the definitions of serious mental illness and intellectual disability, changes on how specialized services are recommended and followed, and then possibly even changes on the level one process. They're looking at a possible appeal process to the level one screen. So there's also some annual reporting changes that might impact you on the way you document your PASRR information. All right, Arizona's process. This is a very high level process, but at the level one stage, you at nursing homes and hospitals are completing that level one screen. And if it's positive or there's any suspicion of SMI, ID, or related condition, you send that forward as a level two referral packet. Coming soon, and I don't have much information on this, but please know that it is coming soon, and you will have an electronic portal process. So you will log in and complete your level ones electronically. We've done this in several states in our system, not for Arizona, but we've done it in other states. And I promise you, even if it sounds scary or concerning, it is a fantastic process. It is wonderful to have all of your results just at a report. You can see things. It's quick. Things don't get lost in translation. It's a really great process. So I do recommend you keep an open mind when those changes are coming, but I really do think you're going to love the outcomes. Once that level two evaluation goes to the level two evaluators, that face-to-face is going to be completed by contracted clinicians licensed in the state of Arizona. And the level two evaluations for intellectual disability related condition are completed by your DDD agencies. So those are separate. If you have a level one that's positive for MI and positive for a related condition or intellectual disability, you need to send that forward to both places. So it needs to go forward for the level two for SMI, and it needs to go forward for the level two for ID or related condition. So make sure if it's positive for both that you send it forward for both, the complete referral packet to both places. Then you're going to get the level two determination, and that's going to come with those recommendations, and that's going to be the most important thing, that you get that one prior to admission. Make sure if you're bringing that person in and that level one was positive, that you ask for a copy of that level two, because you want to look at the outcomes and make sure that the recommendations are something that you can handle at your nursing facility. And hospitals, make sure that you give a copy of that level one and level two to the nursing home prior to admission. If it's upon resident review, you just want to make sure that all of that goes into the individual's record. So the outcome can be one of two things, though. And that's another real important reason to look at the level two and ask for a copy, because if they do not meet level of care, you don't want to admit them into a nursing home. You want to discharge them to an alternate setting. Maybe it's home with health services, or maybe it's into a higher level of care. We see that sometimes. Maybe they need a little further stabilization before they go into the nursing home. If the outcome is they meet nursing facility level of care, they can go into that nursing home. Nursing homes, be aware that you want to get all of that documentation prior, get it into the person's record, and any recommendations documented in the nursing care plan. Now we're going to go through the criteria for serious mental illness, intellectual disability, and related condition. And the reason I do this and I take time on this is, again, I get questions on why am I answering this on the level one, and what is it about? Well, all of the questions that you have on your level one really lead back to this PASRR criteria and that goal that we talked about earlier, to identify anyone with even a possible SMI, intellectual disability related condition. Only a level two evaluator can say if a level two is not needed. So when you're doing that level one and it's positive, even if you think, I'm not sure that this should be positive, you must send it forward, because a level two evaluator is going to handle the next steps. So that level one is just looking for some indicators, any possibility of these conditions. And the level two evaluator and the person and whoever does the determination, they confirm or rule out whether SMI ID or related condition is needed. So I'm going to go through all of those specifications carefully so you know what you're looking for. And I do want to mention to hospitals, what's very important about the level one process is that all of their behavioral health and disability information is added. So maybe they're in your hospital for pneumonia or they had a surgery and you think, well, these diagnoses aren't important. Their primary diagnosis is this and they just need rehab. Well, we don't know how long they're going to stay in that nursing home, and the PASRR process isn't concerned about at first what's their medical condition that you're treating them for. It's looking for anyone with a possible SMI, ID, or RC so that those can be targeted for any services to be added while they're also getting their medical needs met. So please keep in mind when you're filling out these level ones that everything needs to be added as far as the behavioral health diagnoses. So for serious mental illness, everything that you're about to see, it's a few slides, are really about the criteria for SMI. And to have SMI, you have to meet three things. You have to have a diagnosis, and it needs to be a major mental illness. You have to have some level of impairment, some serious limitations. And then typically there's a duration of this illness, but sometimes it might just be some recent severe treatment. And so we look at services they've had or maybe could have benefited from, but they didn't have. Or sometimes it's that lifelong, duration of the illness. So to have SMI, you only need to meet three things. But on the level one, you may only have one or two indicators that will say this is enough of a suspicion to send it forward. So the very first one is that diagnosis. And the federal regulations, like I said, have not been updated since the late 80s. So some of this language might look kind of old, but just kind of crosswalk it. If you've been working in the DSM or the ICD-10 codes, just crosswalk it back. So if they have major depressive disorder or schizophrenia or bipolar disorder, generalized anxiety disorder, PTSD, you want to make sure that those are listed on the level one. We're typically not looking for things like insomnia or adjustment disorder, unless that adjustment disorder came with something else that might be important. But it's usually that major mental illness. Then for the second set of conditions for the criteria for SMI, you have that level of impairment. And they really are looking at serious difficulties or major functional limitations that the SMI is causing, not the medical condition is causing. I know sometimes it can be confusing. They've had a stroke or they have some medical condition and you have some serious difficulties and you don't know, is it the bipolar? Is it the medical condition? When in doubt, go ahead and send that forward because again, only the level two evaluator is allowed to make that distinction. So you're going to be looking for things like serious difficulty interacting appropriately or communicating effectively with others. This is not, they're not getting along with one person, or they don't like a staff person, or they're mad at a family member. This is usually a lifelong issue. They typically have estrangement within their families, trouble keeping friends. They typically will have what you might consider inappropriate reactions, interactions, altercations, things like that. So it's going to be that serious difficulty that you're looking for. And again, when in doubt, go ahead and add that to the level one. Maybe you're not sure how serious it is, but it's better to know and have a level to move forward than to miss somebody. I always say one of the worst mistakes you can make in PASRR is to miss someone altogether. The second thing for level of impairment, we really only need one of these, is serious difficulty in sustaining focused attention or really finishing tasks. So this is someone that's having trouble concentrating or maybe even getting out of bed, that, maybe they're not doing things like they used to. And this is due to the mental illness, not a medical condition. So maybe they're so depressed, they're having trouble paying attention. They're not hearing everything you're saying. They don't want to do things anymore. They're just too depressed to really do much that they used to do. Maybe they're having hallucinations and they have this inner dialogue, so they're not really hearing things the way you're saying them, and they're not able to communicate back to you effectively. They're not able to understand effectively because of the hallucinations. Then the third one is serious difficulty in adapting to typical changes. I like to call these someone's coping skills. So for certain, if you see a lifelong history of problems with coping skills, you're going to want to make sure that's looked at. But this is someone who might have issues with law enforcement. They might have issues with anything with social interaction, schoolwork. Maybe they've had evictions. Maybe they've lost their job. Maybe, and this is the one we probably see the most in PASRR, they have substance use or abuse problems. So if you see someone using alcohol to cope, or drugs, or any kind of dependency, you're going to want to consider that a serious difficulty and make sure that information goes forward. Okay, so the third criteria is that recent treatment or that duration of illness. So if you've had someone that had major depressive disorder their entire lives, please send that forward. Bipolar their entire lives. Maybe they're stable, but what's important is we know going into a nursing home can be very stressful. So that's when things can happen. So it's really important if you see that long duration that you send that forward. For recent treatment, if that may be all that you know, that's okay. The federal regulations state that it needs to be psychiatric treatment more intensive than outpatient care more than once in the past 2 years. I want to point out that these were written in the late 80s, and this may not be something that happens today. So if there's only one inpatient setting, if there's any partial hospitalization, anything that was some intensive treatment for that mental illness, that really needs to come forward. So it can, even if it's a state hospitalization 20 years ago, that doesn't happen with the typical average person. So let's make sure that comes forward. So psychiatric treatment is really important if it's intensive treatment. Or within the last 2 years, due to the mental illness, have they had any type of significant disruption to their normal living situation? Now, this can be those wraparound services for serious mental illness. Sometimes those are court ordered. Sometimes you have court ordered medication. Sometimes they have, residential treatment where they already have some funded housing. Maybe they have SSI for mental illness. Any of those wraparound treatments that you typically see. Okay, so those, I'm going to go back really quick. Those are the 3 things that the level 2 evaluator is going to look at, all 3, and say, yes, this person has SMI, or no, they really don't rise to the level of serious mental illness. You can have a mental illness and not have a serious mental illness as far as PASRR is concerned. So what's important for the level 1 screeners is just look for some indicators. And if there's enough indicators, the level 1 will tell you it's positive. But what's important is you don't leave out any information, that you take your time and complete those thoroughly. All right. For the second protected condition that we're going to go over, intellectual disability, what's important about that is typically they have the diagnosis, it's easy, you already know it. However, as far as PASRR is concerned, you just have to have a suspicion. We already know that. You just might have intellectual disability. And there will be times, especially in some of the older generations, where they were never formally diagnosed. They always lived at home. Maybe they had some supported employment or special education, but they really were never formally diagnosed. So if you have someone that you're working with and they have the significant limitations in intellectual functioning and adaptive behavior based on what you're being told, that might be good enough for a suspicion, and you're going to want to send that forward. So if they've never had that formal IQ testing, that's okay as far as PASRR is concerned. It may not be enough to get them services on a waiver or some other services, but it will probably be enough to get them something recommended for while they're in the nursing home. So we're going to look at age of onset for intellectual disability prior to age 18, typically an IQ of 70 or lower. And then as far as adaptive behaviors, I like to call these their practical living skills. So they're going to have those serious limitations in their conceptual skills, social skills, and their ADLs or personal care, their practical living skills. They might need supportive services to live in the community, to be employed. They might need help with transportation and things like that. They're typically vulnerable to being manipulated and exploited. So you want to be very careful that if you think someone might have this, that you still push it forward, even if they've never been formally diagnosed. So for ID, they're going to have everything started prior to age 18, and they're going to have those significant limitations in their intellectual functioning or a lower IQ, and the serious limitations in adaptive behavior. So they must meet all three criteria to have intellectual disability. But if you have a suspicion, maybe you only know about adaptive behavior, maybe you're not sure what their IQ is, please make sure that goes forward. Now, related condition just means it's very similar to intellectual disability. The one main, I would say, difference is someone with a related condition will only needs to have an issue with their intellectual functioning or their adaptive behavior. So they might have a very high IQ and they've gone to college, but their adaptive behavior, they might have a lot of limitations. Maybe with mobility, they can't do certain things. So you need you need to meet 4 criteria for a related condition, but you're only, when you're filling out the level 1, just put as much information as you know, because you want to make sure it goes forward if there's something that looks like a related condition. So I will say in the definition, I'm going to jump to number 2 for prior to age 22, because I almost wish this was first. Everything has to manifest prior to age 22. So if you have a diagnosis that you think is a related condition, but they had their first set of seizures at age 50, 60, 70, it's not a related condition. So if you know they've had a traumatic brain injury at age 18, that might be a related condition. You're going to want to send that forward. So really everything manifests prior to age 22. You're going to have the diagnosis prior. It's going to be something that's likely to continue for their whole life prior to age 22. And it's going to result in those substantial functional limitations prior to age 22. So if they've had a stroke and today they can't understand or use language and they're not able to get around, but they were fine, they've had seizures their entire life and they've been fine up until then, and that stroke is what's causing it, they probably don't meet for a related condition. Now, again, when these were written in the late 80s, epilepsy was a much bigger issue. There's a lot of great medications now, and it's very well controlled out in the community. You don't really see epilepsy as a related condition any longer. I think most states will see traumatic brain injury, cerebral palsy, autism, Down syndrome. Those tend to be the ones you see the most. But again, all of it starts prior to age 22. And really, what I like to say to trigger that level 2, you only need to have one issue that's with that related condition. So if they're not able to get around, maybe they're not able to drive, maybe they need help to supported housing, maybe they can't live on their own, please make sure that you give as much information as you can so that the level 2 evaluator can make the determination of what to do next for that level 2. All right, so just to go back, for related condition, you have to meet all 4, but it's the evaluator who's going to determine that. That level 1 is just looking for some indicators. All right. Now we're going to go over the PASRR process and how it is supposed to work and all of the things that everyone needs to do, and really all the components of pre-admission and the resident review process. This is another question I get asked a lot. When should we do the PASSR? I think everyone knows it's pre-admission, but there are questions around that resident review, that significant change in condition or status change. So we're going to go over what are the definitions for that. So how do we know? So PASSR stands for pre-admission, screening, and resident review. So that pass part, not to be confused with level of care, but just that pre-admission level 1 that might need a level 2 must happen prior to admission. Every bit of it happens prior to admission to the nursing home. So if they're in the hospital, everything, the level 1 and the level 2, must be fully completed before they go into the nursing home. So new admission is defined as someone admitting for the first time, and it doesn't qualify for a readmission. So let's look at readmission. What does that mean? Readmission means the person is readmitting to the same or a different nursing home directly from a hospital. So if a new admission doesn't qualify as a readmission, what that means, if they've been in a nursing home and they go to a hospital and they go home, or they go to an ALF, they go anywhere besides straight back to another nursing home, even if they've been in that nursing home 10 times, it's a new admission again. So if they're in a community setting, before going back to the nursing home, it's a new admission and PASSR starts over. So a new admission means the first time they're going in, and really if they're coming in, back in, but they went home or they went somewhere besides a hospital. So that's a new admission prior to admission. Resident review for significant change. So someone is in a nursing home, and we're going to go over a lot of the good examples of this. They're in a nursing home and they've experienced some kind of significant change. It could also be a status change, is what some people will call it. So if they are in a nursing home and they're supposed to be in there under an exempted hospital, or a hospital exemption, and they're supposed to be in there 30 days or less, but about day 25, they're going to be there longer. That's a status change. So while they're in that nursing home, you're going to want to have a resident review completed. So anytime there's a significant change in condition, you need to do a new PASSR. You do not have to do them annually any longer. That was removed during the Balanced Budget Act. I forget what year. It's on one of the slides I showed earlier, but you no longer have to do it annually. If they have a significant change in condition, you do need to do it. So what that means, because we don't have to do it annually anymore, is, and this is great, if they're in a hospital and they go into a nursing home and everything is going well, and they want to change to another nursing home, and it's just an inter-facility transfer, all of their PASSR documentation just goes with them. You want to make sure you give them everything so that it stays in the person's record. That's part of the federal regulation. So they get a copy of the PASSR level 1 and level 2 for that transfer, but they don't need a new one. Unless they're going in because there is some kind of significant change in condition, they do not need a new PASSR. They can go into a hospital in between, and it can still be considered an inter-facility transfer. So they can go nursing facility, hospital, another nursing facility. And you don't have to worry about doing a new PASSR again, unless there was a significant change in condition, and we'll go over those. Readmission means they are coming from that hospital, whether the nursing home, they're going into a hospital, and they're going back into the nursing home. They never put even a toe in the community. They've only been in a hospital or a nursing home, and that's a readmission. So interstate transfers, sometimes you might have a border state that wants to discharge someone from their hospital into a nursing home, or possibly do an inter-facility transfer. What you're going to want to make sure that you do is get a copy, just like we talked about, of the other state's level 1 and the other state's level 2 if it was indicated. That is extremely important, because if they're doing that interfacility transfer or coming from a hospital, you want to read that level 1 and level 2 and make sure, that one, you can handle that person, whatever needs they have, that's someone that you can support, but you need all of the documentation. It's going to go in the person's record. Then you're going to want to do a new level 1 for Arizona. And if it indicates a new level 2. And the reason why is other states sometimes have different criteria in their level 1 that trigger a level 2. So maybe that state doesn't have a level 2, but your state's going to, or vice versa. Sometimes states have different arrays of services. So maybe the other state's level 2 is recommending services that you don't have. You're going to want to do a new level 1 and a new level 2, right at admission, and follow, the results of those that level 2 outcome if needed. So for anybody you're bringing in from another state, make sure you get a copy of the entire PASRR process if it was completed, and that you start that again at admission. Okay, elements of the level 1. So we've talked a lot about this, but I really want to emphasize how important it is when you're filling out that level 1 that you're just identifying. And sometimes you might feel like you're over identifying, and that's the goal. We don't want anyone to be missed if they even have a suspicion of SMI or ID related condition. So prior to any Medicaid certified nursing facility, that's usually most of them, most nursing facilities are Medicaid certified. There are some Medicare only. If they do not have that Medicaid license, then they do not have to participate in PASRR. If they have they're Medicaid certified, but they don't really have any Medicaid beds, and maybe no one in the building has Medicaid, it doesn't matter. If they're Medicaid certified, anyone coming in needs to be screened by that level 1. And again, the most important thing is that we identify or even over-identify anyone with a possible SMI, ID, or related condition. And then whoever does the level 2 is going to determine those next steps. Maybe there's a categorical outcome. Maybe a full level 2 evaluation and determination is needed. If the level 2 evaluation is needed, it's an individualized, in-depth evaluation. So they're going to want to get a lot of information, documentation, and really, if this might feel like more of that paper process, just know that all of this is in the federal regs. They state exactly what kind of information has to be looked at. Physical exams, psychosocial history, substance abuse or use history. So there's a lot of things that they're asking for because it's required in the federal regulations as part of that evaluation and assessment process and making that determination. So it's individualized and it's that in-depth evaluation looking at any criteria and then deciding, do they meet that criteria? Do they need any specialized services or specialized rehabilitative services? Those are what you might hear called those lesser intensity services. Those are the services that the nursing home provides, but they might be recommended for that individual with a condition, with one of those protected conditions. All right, so the objective of that level 2 evaluation is to really get all that rich information, the documentation, the history, and do the evaluation and decide, do they rise to the level of having serious mental illness or intellectual disability? Or can we, just stop what we're doing? We don't need to go any further. They do not have SMI, ID, or RC. We can just tell. But if they do they need to go into the nursing home? And if they do, what services might they need to support their SMI needs or ID needs on top of their medical needs? Now, those group or categorical is what they call them, group determinations. So you can do an individualized evaluation or a group type of evaluation or determination. And that just means someone in this category or group, we know that they may not need a level 2 today. They might need it in the future, but I like to say these kind of bypass that full level 2. So we talked a little bit about the terminated cases. We don't need to go forward. There's no indication the level 1 triggered for a level 2, but in looking at it, they don't have SMI, ID, or RC. There's no PASRR condition. Or if they have SMI, maybe they have schizophrenia, but they also have primary or an advanced dementia along with that SMI. Well, those are mutually exclusive. And if you have a primary diagnosis of dementia, you can still have schizophrenia and it might still be serious. But as far as PASRR is concerned, you do not have an SMI, only as far as PASRR is concerned. So a level 2 does not need to be completed. And the reason for that is, and I think the federal regulations were great with this, they knew someone with dementia needed that nursing home setting. They need that 24-hour supervision. It's terminal, it's progressive. So they didn't want someone, who wouldn't benefit from specialized services to have to go through an unnecessary process. Now, the difference with dementia and intellectual disability and related condition is technically it would go forward for that level 2. It is required. So if they have dementia and possible IDRC, it's going to still go forward. However, your DD agencies are allowed to make a categorical determination that specialized services are not needed. Maybe it's so advanced that they're still going to make a determination that a full level 2 evaluation is not needed. They may not benefit from specialized services, but typically they will do, in most states, they will do that full level 2 evaluation, but just maybe not recommend the specialized services. Now, categorical determinations, there are a couple of conditions that a level 2 is not required unless there's significant improvement. Now, significant change in condition might be significant improvement. I think a lot of times we think significant change is, behavioral, and there's, maybe some symptoms, and it typically seems like that significant decline in condition. Well, it's also defined as significant improvement. And usually where we see that the most is someone with terminal illness or someone with some kind of very serious medical condition. They're so sick that they cannot participate in the evaluation, and they're not likely to benefit from specialized services. However, we know that sometimes things change and they get better. And okay, someone said the sound is messing up. I do want to, I'll scoot forward and I hope that will help. But sometimes the conditions, they get better. So they might have major depressive disorder and they're getting better. Well, let's go ahead and move forward with that level 2 evaluation in case there are some other services they might benefit from. So it's very important, if they have some kind of categorical condition that delayed, or they didn't do the level 2, but they got better and they can participate and they can benefit from specialized services, possibly, let's go ahead and do that level 2. You're going to want to send in for a resident review for significant change. And then we have more provisional admissions, and these are time limited. So there's respite. If someone has a caregiver and they need a break, and we know that they do, they can go into a nursing home, bypass the level 2. They're just going to go in for a short time and then go back home. So as long as they go in under respite and they leave within 30 days, you don't need to do a level 2. If for some reason something happens, maybe the caregiver gets sick and can't come and get them, and it looks like they're going to stay longer, you must do the level 2. We typically recommend you start that process early. Start looking around day 20 to day 25 at the latest. And if the person's going to stay longer, go ahead and start that PASRR level 2 process. Same with exempted PASRR hospital exemptions or convalescent care. Those are for 30 days in Arizona. If the criteria for a hospital exemption, someone's in a hospital, they're being treated for an acute care condition, that they're going into a nursing home to get the same follow-up care. So it's going to be the same condition. You go into that nursing home, you're going to be there certified by a physician. A physician has certified you're going to need 30 days or less. So you're in there. Again, if at day 20, 25, it looks like that person's going to stay longer, go ahead and start that PASRR process. You don't want a gap in care. So if after the hospital exemption or convalescent care, they look like they're going to stay longer, make sure that you start that PASRR process. Now, to be eligible for the exemptions, they must not be at risk of self-harm or harming others. And I think we all know that that's very important. But you want to make sure if someone is not stabilized completely or something is making them a danger to self or others, that you don't move them forward without that level 2, especially. So again, these are those group determinations. They're either bypassing the level 2 altogether or delaying it for a little while. But if they go past those time limit approvals, you want to make sure you get the PASRR level 2 completed. Okay, so the level 2, just gonna recap it a little bit, prevents individuals with these protected conditions from being inappropriately housed. Nursing homes are not housing. They are for medical care. So long-term care needs, absolutely, if they have those medical needs to be met, that's wonderful. But if they also have a protected condition of SMI, ID, or related condition, that they're fully evaluated before they go into a nursing home, especially for long-term care. And it, again, assures that they're going in there because they have, the medical needs as well, and they're going into the least restrictive setting that best meets their needs. And they get services. So if they need specialized services or those lesser intensity services, they get any services to make their mental health needs and their ID needs all get met. So those federal regulations that I talked about with the documentation, you want to make sure that you provide, when you're sending that individualized level 2, you're sending it forward, and they need to make a decision, or they're making a categorical decision. They may still need all of this. They're going to need your face sheet. That gives a lot of good information on diagnoses and contact information. And then also it can help to know, like, sometimes you'll have more than one admission. They can see, certain histories. You're going to want to send the history and physical. The current one is best, but it really needs to be relevant and still accurate. Medication list. These can sometimes change. But the most current medication list or physician's orders is critical. They might be on something like Haldol for nausea. Well, that will let the person know that it's not for some kind of psychosis. And then you want to send any recent psychiatric consults or evaluations. It's really important that those go in as well. If they haven't been seen, that's fine. You might want to send a note and let them know so they're not asking for it just in case. And then your current medical and nursing notes, progress notes. Usually about 2 weeks is a great amount of time, but they might ask for additional information if there are any concerns. And then if they have a guardian or a power of attorney or someone like a healthcare proxy or someone that helps them make those decisions, please send the documentation for that. What's great about that is if the state has the documentation or the level 2 evaluators have it, they know if they can call and speak to someone and they can have them join the level 2 evaluation also. All right, resident review. This can be sometimes confusing, but what we talked about earlier is there's no more annual resident review. It's just upon significant change in condition. And I'm going to go over that in probably with the question I get asked the most. And then I see other states also asking at CMS and PTAC. This comes up a lot. Well, what if the significant change doesn't have anything to do with their mental illness? How do we know? The regs say you have to submit it. So why wouldn't we submit it? This is why. So this language here says with respect to. So what a significant change in condition means is someone has SMI, ID, or related condition, or likely has. There's a strong suspicion, and they've had some kind of significant change in condition with respect back to that SMI or ID related condition. So if they're going into a hospital for pneumonia, that's not a significant change in condition. Just because they have SMI, you don't need to do a new level 1 or level 2. But if they're going into the hospital because of failure to thrive, because they're too depressed to eat, or they're paranoid and they think that you're poisoning them, so they're refusing to eat, well, that's with respect to a serious mental illness or possible serious mental illness. So you want to make sure that that significant change in condition is about the PASRR condition. And if you don't know and you're not sure, it's better to send it forward and let the level 2 evaluator make that call. So again, you don't have to send every time the MDS says a significant change in condition. And that was confusing to folks. They were saying, well, this medication is significant, but it was off label and it had nothing to do with SMI. What CMS did, because of all the questions, is they sent out some really great information. And I do have, and you'll get these slides, I do have a link to the manual. But they, just what I said, they point back to, it really needs to be someone, if they already have SMI, IDRC, that they're going through some kind of significant change related to that, with behaviors, with mood, maybe a new diagnosis. Maybe they've been in your nursing home and it seems like baseline, but they're just not getting better and they need that new level 2 evaluation. Maybe they've expressed the desire to leave the nursing home. They want their services in the community. That can be considered a significant change in condition if you're filling out, if you're the MDS coordinator and you're filling out that section Q and you have a yes answer, you might want to look at sending that in for a resident review to see what might possibly be out there for that person, what options are out there. But again, it's really about that PASRR condition. Now, if they've never been diagnosed, and we typically see this with SMI, you don't typically have a brand new diagnosis of ID or related condition. You might learn about it. You didn't know until the family told you. So you do want to submit. But usually, if you have a significant change in condition and they've never had a diagnosis, it's something that's happening with a mental illness. A brand new diagnosis, brand new medications really needs to go on a level 1. You need to make sure that gets sent in as a significant change in condition, especially if they went inpatient. Sometimes even if you send them to the ER and the ER sends them back, that's still significant. You're going to want to make sure that you send that forward. So please, if there is any inpatient or maybe even ER and you would have liked to have seen them get admitted, but it didn't happen, you're going to want to still submit that for a significant change. Oh, I do want to go back to a significant change based on SMI. So if they had a UTI and there's really nothing going on and they went back to the nursing home and you know it was medical, you do not need to do that for significant change. All right, PASRR level 2 evaluation criteria. This is more of a recap. These are the things that the level 2 evaluators and the staff making the determinations are looking at. Did they confirm if there is a serious mental illness? They had to look at all of this information and the evaluation to do it. Now, what are the outcomes? There are 3 important questions that we've talked about that have to be answered for that level 2. Do they even have SMI, IDRC? Do they need to be in a nursing home? Is that the most appropriate level of care if they do have SMI, ID, or related condition? And what services, specialized services or lesser intensity services, are they going to be possibly might be recommended? Again, if you don't hear anything else today, please hear this. All of that PASRR documentation must go in that person's record, including any recommendations. You have to document them in the nursing care plan. You can change them. So PASRR might be a one-time assessment. We know that when the person goes in the nursing home, you've got a doctor, nurses, you've got an entire treatment team that's known this person possibly long-term, and you might have a better idea of what is going to be best for them. You can make changes to the recommendation. You just have to document, this is what the PASRR said, this is what we're going to do instead, and this is why we're going to do that instead. So it's document, 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 all in the person's record. And again, these are just some of those recommendations that you might see. And I like to point this part out because I've had this call, this comes up so often. A nursing home calls, states in the building, where is our level 2? The hospital said it was done. I don't have it. Can I get a copy? Well, sure, you can have a copy, but it said nursing facility wasn't appropriate. So you want to make sure that you get that level two, the level one and level two prior to admission, because maybe they were recommended to go into an ICF or maybe into an ALF or back home with services. Maybe they were given 30 days and now it's day 90. Maybe they were given 90 days and now it's been a year. So you are, what could be, you're out of compliance for sure, but what could be an issue with Medicaid reimbursement. So you want to make sure that you get all of those level two, level one, all the documentation prior to admission, and that it matches, what should have happened before you bring them in. And if there are any services that you don't think your nursing home can provide, you want to make sure that you don't take a level two evaluation and recommendations if there's something in there that you can't provide for that individual. Okay. So here are some of the recommended services. And they're really, the difference between specialized services and those lesser intensity services, really, there's only one main difference. One is paid for by the nursing home, specialized services of a lesser intensity. So specialized rehabilitative services, sorry, those lesser intensity services are services the nursing home already provides, but maybe they're recommended at the level two to either continue or maybe increase, or maybe they're added because, for example, we know someone with major depressive disorder that's very depressed. They could sometimes benefit from physical therapy. We get them out of bed. They're no longer isolating. They're moving. They're starting to feel better. Or specialized services. The main difference there is somebody else, usually the state, is funding them. So it might be the health plan or your state plan funding them, but it could be that psychiatric psychiatric medication management or consultation or any follow-up care. Those are the typical ones that we see. For ID, typically they're when you're in a nursing home and you have ID related condition, some of your services typically stop, but there can be some services that can continue. It's rare, but you do see the sometimes ADT or things move forward. But usually when you're sick, until you go get better and go back to your waiver services or your group home or whatever, those services are typically provided in the community, but they can be provided in the nursing home if that's determined to be needed. All right. This is just a recap, so I'm not going to go over this too deeply, but again, to recap, if it's specialized services, they're acute. Something is going on that means they're going to need these services to keep them in the nursing home. It's actually going to sometimes even be a lesser level of care. So maybe they're in a psychiatric unit and they're coming down to the nursing home, and this is going to help continue their care so they get all their medical needs met at the same time and they get better. But the whole goal is to make sure that we're reducing those symptoms. Again, going into a nursing home can be very stressful. So this is a time, if you're going to see issues, you're going to see them, at this time. You're going to want to make sure you have a plan in place in case it happens. So as far as who must receive them, this is just straight from the federal regulations. It's really anyone with a serious mental illness, intellectual disability related condition that's going into a nursing home. If they're found to have this protected condition, the recommendations can be made of specialized services. We see a lot of lesser intensity services. That's what you're going to see the most. Both or either, whatever's recommended must go in the nursing care plan. And again, you can change it. You just have to document why. So there are sometimes those specialized services that are not something you can do in a nursing home. So if they are so acute, they need to be in a psychiatric setting or a higher level of care, the level two evaluator is going to make that decision. But there might be some services that they can have while they're in the nursing home. And we want to make sure a specialized service is provided by an individual that understands the needs of someone with SMI, ID, related condition. So make sure when you get that level two back, you look at the recommendations and you add those to the nursing care plan. Remember I said there's basically 3 steps: the level 2 evaluation and the level 2 determination. I've been saying this all along, and I know that I do bring it up a lot because it's prior to admission or a significant change in condition. But then when you get that determination, that level 2 determination, all recommendations make it into the nursing care plan. Specialized services, lesser intensity services, it all gets added. And you're going to get a copy. If the hospital's going to get a copy, the admitting nursing facility will get a copy. And if the individual, wants a copy, or their legal representative, they can get one as well. But everything needs to go into that nursing home file or record. The notification, I just went over that. This is who all is going to get a copy. And again, if for some reason there's an adverse determination, there are appeal rights. So maybe they were found to not be appropriate for a nursing facility setting. Well, there are appeal rights. So you can look at that adverse determination and decide, do we want to, have a new level 2 done or appeal that? So either way, if there's an adverse determination, those rights are protected for these individuals. So I get asked quite a bit, why do I have to put all of this information in the nursing care plan and in the records? This is why. And this is that 2016 rule that I talked about that was updated. And, we have staff turnover. So I do bring this up because, everyone that was working in 2016 knew about it. There was a lot of training, a lot of outreach about this. But as time has gone on, so level 1 goes in the record, level 2 goes in the record. If there are any recommendations, they go in the nursing care plan. If you want to make a change, you just document it. So this is a nursing facility compliance check that you can do. I don't know if some of you are doing those self audits, but look in your charts and see, did they possibly have SMI or related condition or ID? Was the entire PASRR process finished? If you have a level 1, you can't find the level 2, find it, get it done. Was there a significant change? Did you have maybe an inpatient admission, something that happened while they were at the nursing home? If there was a new diagnosis and medications, make sure that resident review was completed. PASRR conditions to consider. I'm not going to go over these very closely because I know we're coming to the end of time and I want to have a lot of room for Q&A. But when you're filling out that level 1, when the DSM updated, most often you see major depressive disorder. You might see mild or moderate or severe. You don't tend to see the dysthymic disorder or the cyclothymic disorder any longer. But if you see that mood disorder unspecified or major depressive disorder or bipolar disorder, you want to make sure those are listed on the level 1. Again, you can have a mental illness and not have a PASRR serious mental illness. So make sure any of those indicators or any behaviors or symptoms associated with the mood disorder are added to that level 1. You're also going to see a lot of what we call the psychosis or psychotic disorders, schizophrenia. If you see someone being diagnosed with schizophrenia later in life, that's unusual. You want to make sure that goes forward for a level 2. If CMS is very concerned about these late in life diagnoses and following medications. So when you're adding a diagnosis of schizophrenia or schizoaffective, or your doctor is doing that, and there's a medication added, please make sure that goes forward. CMS is going to want to see a resident review when that happens for sure. But if you have any of these in their history, it's always good to send it in. There are some individuals with schizoaffective disorder that can be very stable, and when they cycle, it might be once a year or once every 2 years. But when they cycle and when it hits, it can be significant. So, really look at that diagnosis and send it forward, even if you feel like it's historical. For anxiety disorders, we tend to see the PTSD the most. But you'll see generalized anxiety disorder. Sometimes they'll just put, anxiety. Typically, anxiety by itself, it's not going to rise to the level of serious mental illness. But if they're having panic attacks, if it's impacting their ability to work or get out in the community or do things, probably a good idea to send that forward. Now, the related conditions. This is a huge list, I know. And believe me, it's not everything. You're going to tend to see cerebral palsy, traumatic brain injury, maybe spina bifida, autism, Down syndrome the most. But if it's a condition that happened prior to age 22 and there were significant limitations that started prior to age 22, go ahead and send it forward. Anything that looks like a related condition, send it forward. Substance abuse. A while back, there started to be a push for alcohol dependence and substance abuse or substance use disorders. And the reason why there was a push to get them evaluated for SMI is because there tends to be a correlation. So a substance use or substance abuse disorder by itself cannot be considered SMI by itself. But we don't often see them by itself. We'll see it with depression or with bipolar or with schizophrenia. So there's not any good research that I've seen lately. I haven't seen anything that leads me to believe there's a true causation. But there's good research that says one leaves you vulnerable to the other in both directions even. So using substances can make you vulnerable to a mental illness, and having a mental illness can lead you being vulnerable to having a substance use or related disorder. So please make sure if this is all they have, that you're really looking at everything to see it may not qualify for an SMI, but it might need to go forward to have a level 2 evaluator do a deep dive into their history. Dementia, I did add this because again, we have that, why is dementia mutually exclusive with SMI? And again, because it's progressive, it's terminal, it's not reversible. There are going to be times when you're not sure what's causing what, the dementia or the mental illness. Please send those forward because someone with mild dementia can still benefit from services. So let the level 2 evaluator decide. It's also hard to get a doctor sometimes to say, yep, this is a primary diagnosis of dementia. You don't see primary diagnosis of dementia very often. You'll see advanced. You'll see primary course of treatment. And so, giving all of that rich information to the evaluator will help them decide what needs to happen next. But again, mutually exclusive, you can't have SMI and primary dementia at the same time. You can have a mental illness. It just may not be a PASRR, serious mental illness. Ruling out dementia really needs to be done by the level 2 evaluator. And they might have conversations with you, with the individual. We're going to dig into the medical history. But we know there are some things that look like dementia, may not be dementia. So if a doctor, says rule out dementia, please don't think that you don't need to do a level 2 because it could be anything. It may not even be a true dementia, and it might just be cognitive decline and may never, turn into a dementia. So you need to understand that even if you see dementia, let the level 2 evaluator determine by looking at everything if it's something that can still go forward for level 2 evaluation and get that determination. All right, we are to questions. So again, love questions. I know I speak really fast. Please ask if you have any. And I'm going to look at the chat. I know someone said something about the sound. I hope that's better. And you will get a copy of these slides. We're going to send a PDF version to everyone that attended. That was another question. And you can come off mute. You can raise your hand. I'm more used to Teams and the raising their hand, but ask in any way if you have any questions. Might be a quiet group, but we usually get a lot of questions. Anything about significant change, anything about the level 1 or level 2, anything at all.
I have a question.
Good, thanks. Go ahead.
My question is if there are indicators for a level 2 evaluation and the resident is their own decision maker, but they refuse to agree to the level 2 evaluation, can they do that and make sure we're compliant with PASRR regulations?
So that is a very good question. So everybody has choice. They can absolutely say, I'm not going to be evaluated for PASRR, but then they really shouldn't move forward. So it puts your nursing facility at risk to admit someone who is saying, no, I don't want to do a level two evaluation. Usually it's they just don't understand the process. When we have that happen, we'll usually have a manager or a supervisor or someone that really understands the PASSR process, call them and talk to them. And usually when they hear, oh, I'm not going to lose Medicaid over this, I'm not going to be told I can't go into the nursing home when I know I'm sick. This isn't about my benefits as far as, I'm not going to lose something medically. They're usually worried. They may have been burned by, that red tape or bureaucracy in the past, and they don't trust the process because they don't understand it. So I recommend that you take the time to fully explain the benefits of PASSR. Getting a PASSR completed means when you go into the nursing home, you're also going to get possible extra services. So maybe if you're depressed, you might get therapy. You might get a psychiatrist to see you. There's things that you will benefit from and it won't harm you. The only time you're going to say someone or an evaluator isn't going to let them into the nursing home per se would be there's some kind of acute instability. There's something where their mental health needs supersede their medical needs. And that might be why they're saying no. Maybe they're too paranoid to talk to someone else. Well, they're probably not ready or stable enough to go into the nursing home at that point anyway. So they really do have to participate in PASSR to go in. As far as significant change, there's a little more, leeway on that. If they're, nope, no one's coming in, I'm not talking to them. I would just document that the process was started. You've done everything you can. They'll probably, do what they can as far as an abbreviated, level two on their side. But prior to admission, it needs to happen, or they really don't need to be going into that nursing home if they're unwilling to participate. You wouldn't let them go in without a history and physical or without whatever other admission process. They don't get to skip PASSR. But usually that level one screen maybe wasn't explained well to them. And so they're level two, what are you talking about? This sounds scary and new. And typically if you spend some time with them and let them know the benefits and that, it's not going to hurt them, then you're typically going to be okay with that. Did that help? Was that
Yes, that was very helpful and right in line with how we approach the conversation. It's usually short term or
Mhm,
residents that admitted for a short term acute stay, and then we determine they're going to end up needing to stay longer. We
mhm,
we perform that new level one screening. Now they have indicators, and then they're not in agreement or in understanding of what the process is. So yeah, once we explain
mhm,
the potential for additional services and things, it usually goes well. Sometimes they're in straight denial of any mental
mhm.
health conditions and just don't want to participate. But thank you very much. That was helpful.
Well, and two, it's so important it's a Medicaid federal regulation, it's a requirement. So again, if they are a Medicaid member, they really do need to go through the process. I know that some states have a documentation process for Medicaid members, but I'm not as familiar with Arizona, but I can get you any information on that if you would like it. But yes, they do need to go through the PASSR process if it's triggered. It has to happen um, for a Medicaid certified nursing home. And then I have a what does conclusion of time load approval if individual is in the facility less than 30 days mean on the Arizona PASSR? Okay, so if somebody is going in for an exempted hospital, a hospital exemption, or they're going in for convalescent care, they only get 30 days. So if they're going in and it looks like they're going to stay longer, then you have to do that level two. So what um what happened for an exempted hospital discharge is you only need it if someone is possibly going to need a level two. So if they don't have any conditions, they don't need a hospital exemption and they don't, they might be going in under convalescent care, but the PASSR is not going to trigger. But if they have a possible PASSR condition and they're going in for convalescent care or an exempted hospital discharge, they they are not going to do the level two unless they stay there longer than the 30 days. So again, you want to start looking at day 20, day 25 at the very latest. If they're going to stay longer than that 30 days, they need to go and you need to start that level two process. So that just means if they're going to stay that once that 30 days ends, PASR's done. You're out of compliance on day 31. There might be a cushion in the federal regulations, and some states use that cushion and some states don't. So on day 31, you're technically out of compliance with PASR if they're still in your nursing home and you never had the level two completed. I hope that answered your question, but if not, Jamie, if you want to send a follow-up in chat. And then Ellen, can you reiterate the potential risks associated with facility non-compliance with PASR? Absolutely. And then specifically as it relates to the pre-admission process, also, can you speak for ensuring PASR process prior to admission? Yes. So the biggest risk is to the person. They're disenfranchised. They have a condition, gotten services, maybe, you don't know, you didn't do the PASR. Want anyone with a protected condition being disenfranchised. Now, for compliance purposes, you're out of compliance if you don't have the level one, and if indicated, the level two completed prior to admission. And what's important about that is you don't get to be paid for Medicaid. Medicaid reimbursement can be taken back or not paid at all if you are out of compliance with PASR. The chance that not going to be reimbursed for Medicaid. So if someone is in your nursing home and they don't have Medicaid, you're still out of compliance and you're probably going to get a tag. The surveyors are going to let you know, and you don't want a tag. But if you get a tag and they're on Medicaid, you are at risk for losing that Medicaid payment. So it is critical to be in compliance with PASR, regardless of whether they're on Medicaid or not. And then ultimately, and this is just one of those things where nursing homes are really on the hook for PASR. Your nursing homes are listed throughout the federal regulations. Nursing home must this. So when you are admitting someone from a hospital, carefully look at that level one and make sure it matches the admission documentation. If the history and physical that you were given says schizophrenia, but the level one is negative and doesn't have anything listed, ask for a new level one and then the level two that's going to come afterwards. So you really want to do your due diligence. And usually your admission staff are great at that. It's typically the ones that help in the evenings or the weekends that get you. So I always recommend putting up a flow chart or, making a real clear, easy to find C policy of before you admit, look at that level one, make sure it makes sense. It matches all of the documentation and what you know of this person so that if a level two was needed, it happened and you get that prior to admission. Because again, it's really on the nursing home. So, you can say, oh, the hospital left this diagnosis off. That it's going to be the nursing home who might get that Medicaid reimbursement taken away or the tag. And, it's not going to be, the hospital missed it. The hospitals only know this person sometimes a day or two. They may not get all of that history. They may not, have a chance to really learn things. Or they may be new. Maybe it's a new person at the hospital and they didn't understand the level one, unfortunately, and they left something off. So it really is on the nursing home to do the due diligence prior to admission. So I hope that answered that question, Melissa. Let me know in chat if not. And then Jamie, what is the significance of some of the demographics on the level one screening? How are they used? Example. Okay, so what is can be helpful for that is one, we know what kind of supports they may or may not have. Again, that can kind of build that picture of, estrangement, possible, no supports, things like that. So it can just sometimes help to know what kind of services they may benefit from. Especially it might be peer counseling or peer supports if they don't have those supports on their own. is there any information about their supports that you may even want to know? Maybe someone's not supposed to be coming to visit them, things like that. Um, and then when only male and female options are listed on the form. Well, we all know that that can be, really anything and how they identify. And you want to make sure that you're very clear. If even if you have to write it somewhere, be clear on that. If they get the sex at birth and put that, that's fine. But again, you don't want to misidentify anyone. So make sure you're putting that information on there because the person coming in to do the level 2 face to face, they don't want to misgender anyone either. So make sure that if you're being asked for the sex at birth, if there's any other information that you provide that information. Okay, Melissa's question was answered, and I don't see any others so far. I'm going to go to the next page if you are willing. We would love if you could do a survey for this training, and I'll still answer questions if they come in a chat. But if you can uh, do a survey for us, this QR code, you can, get your phone. I've recently learned about QR codes. I feel like everyone's known about them forever. But if you take a picture, you can go to the survey. It is quick. It is less than 3 minutes. The surveys told me it was 3 minutes, but I don't think it'll even take that long. But that information really helps us for the next training. So if there was something, for today's training, we might change it even on Thursday. We're doing another follow-up for this on Thursday. So we would love that feedback if you wouldn't mind. That would be great. We will send a link also via email to anyone that attended today. So any questions or anything at all? We can finish a little early. If you have a question later, feel free to send it to Tamara, who is hosting this for us, and she can get it, to the right person, and we'll get it answered for you. But we are completing some additional Q&A that will come out from this training, and those will be added to the website as well. But thank you so much, everyone. I truly appreciate your time today. If we want to stop the recording, Tamara, I'm not sure how to do that.
Sorry, moved it to my smaller screen so